Health Cabinet Secretary Susan Nakhumicha now says the Social Health Insurance Fund contributions are likely to remain as stated in the draft regulations at 2.75% of members' gross salary. The CS speaking in Trans Nzoia says this is the only way to ensure that all Kenyans are comprehensively covered under the new scheme that replaces the now repealed NHIF. The CS statement comes as private healthcare providers continue to complain over delay in the disbursement of funds by the NHIF to their facilities, hampering service provision. Brenda Wanga has more.
The social health insurance scheme may not have taken effect yet due to court action, but the government through the Ministry of Health says it knows how much those who will have subscribed will part with to access the comprehensive care to be offered under the scheme.
Pamoja na rais tumetengeneza sheria utakuwa unalipa 2.75%. Watu wa mshahara kubwa wa milioni moja walikuwa wanalipa 1,700. Hiyo ni 0.01%. Wale wameenda shule wanajua that is not equitable. Sasa kila mtu 2.75%.
The proposed rates are yet to undergo public participation, but the CS says the regulations will also see those unable to pay to access the services paid for by the government.
Wale wako na pesa walipie wale hawana. Lakini cha muhimu pia ni kwamba rais ametenga pesa ya kuhakikisha wale ambao hawana uwezo, indigents, wale hawana mapato ya aina yoyote, wale ambao labda ni viwete, hajiwezi, anaishi na disability, rais ameweka pesa ya kuhakikisha ya kwamba anawalipia indigents na wote wanakuwa covered under Social Health Authority.
The fate of the Social Health Insurance Fund lies with the courts, with 3 cases pending before them. The cases are set to be heard next year, but as the fate of the new scheme hangs in the balance, the old and now repealed scheme has been running into financial headwinds that threaten to disrupt service provision in private health centers across the country. Private healthcare providers say NHIF has not been dutifully remitting the finances for the smooth running of their facilities.
We're really suffering. We are even unable to give our patients drugs. Not that we are refusing, but we cannot afford. As you can see here, there is no patient whom we are seeing. Because when they come here, we tell them that, yes, we give them consultation, but we don't have drugs in the pharmacy. We don't have drugs in the pharmacy. So we tell them to go and buy, because in rule of setup, the private hospitals, most of the private hospitals are giving comprehensive service.
We have payments accruing from up to October. Currently, we've not received. And specifically, the county of Kajiado, Narok, Turkana, and Nakuru are really suffering in this. We have had to strain a lot by, missing to pay our staff salaries. We have not, met our obligations with our suppliers. We have a lot that is pending. Even the statutory deductions have not been paid.
The private hospitals' complaints come as the government insists that it has disbursed part of the funds through NHIF. That money, private hospitals say, hasn't reflected in their accounts, and that situation is making it difficult to render services to those who need them, especially in rural areas.
Kabla tufunge wiki iliyopita tukiwa Nairobi tuliketi chini. Of course tumekuwa na changamoto kwa sababu ya hiyo kesi ambayo iko kotini, because the NHIF was ideally repealed. So kufanya kazi imekuwa na changamoto kiasi na tulikuwa na some delay. But by last week tulikuwa tumetayarisha pesa na tumerelease 3 billion Kenya shillings ya kufikia hizi facilities za mashinani zote. So hakustahili kuwa na changamoto yoyote yule mtu ambayo ako na card.
We have not been paid a single coin. By announcing it in the papers and over the TV that they have been paying us, it's putting us into conflict with our providers or suppliers, where we buy drugs from them because we cannot afford to pay. They are also putting us in conflict with the patients, our clients, when we tell them that we don't have money to pay to buy drugs. and yet they are told that we have already paid. That is, we were paid.
The private healthcare providers have threatened to have NHIF card bearers pay upfront in cash for services at their facilities if the money owed them by the NHIF is not remitted. The association says it had withheld that action on the promise that the funds would be released. A decision on the next step will be taken after Tuesday next week. Brenda Wanga, Citizen TV.